I want my patients to work on coping skills, and I want them to have a number of coping skills right on the tip of the tongue, right there when I ask them, how are you doing with your coping skills? I want them to say, well, I do this, I do this, I do this, I do this. And for that to be very, very accessible for them. I think that when people are in the Suboxone program, oftentimes they feel because they don't have withdrawal and their cravings are under control that everything is fine, and then something stressful happens and they relapse. And it's because they don't want to work on building coping skills, even though every visit they come in, I talk about what are their life stressors, how are their coping skills, those sorts of things, because people feel well, they fool themselves into thinking that everything is fine and they don't need to work on the coping skills. So what I'd like to do is I'd like to go through some different coping skills that people might want to think about. And so recently I've been actually writing out a list of coping skills that people should be thinking about when they're making their own list. So the list that I'm going to suggest for you is not the only list. It's just some suggestions that that you might want to think about when you think, okay, I need to have a bunch of things that I've tried that are effective for me that I'm going to use for the rest of my life when I need to have emotional escape, or I'm feeling this way or I'm feeling that way. And so when you're feeling like you've been treated unfairly, that you've been abused, that you're feeling angry or frustrated, or you're feeling disappointed with yourself, or whatever it is, there's a number of different things that you could potentially do. So the first area is exercise. Exercise releases endorphins from your brain and enkephalins. It makes you feel like you've done something good for yourself. It changes the internal negativity around, and it gives you something to say, hey, I did some good work today. It helps you sleep better. It just has all kinds of benefits for people. And so going for a run, going surfing, doing sit-ups, doing push-ups, whatever, are things that you should do. And you should have a number of different things that you feel like you can do, so that at 2 o'clock in the morning, if you're like at the end of your rope, you can be like, well, I'm going to do a set of sit-ups, or I'm going to do a little workout routine for 10 minutes, just to kind of get over the hump, just to buy yourself some time to let that intensity just settle down a little bit. Exercise can be very, very beneficial. Number 2 is talking to someone. So that someone could be a friend, it could be a counselor, it could actually be the person who hurt you, and that the emotion that you're feeling is related to. Now, a lot of times people have tried to talk to that person before, but it hasn't gone well because of trust issues, or the other person's just a jerk, or whatever. And so what you can do is you can virtually talk to that person by writing a letter. And a lot of the times that letter does not need to be sent, and many times it shouldn't be sent because it's just going to make things worse. Although, you never know. Sometimes, writing it out in a way that is careful and is not accusatory, just kind of, spells things out in a very calm and matter-of-fact way, can kind of move things forward. Because a lot of times, as soon as the topic is raised up, everybody gets all upset and, immediately starts yelling at each other. Which is something that has happened to me, I'm sure, many times. So consider writing a letter and just kind of working it out in your head if you feel like you can't talk to the person. So the other thing, so that's topic number 2. The topic number 3, or area number 3, is to do something to take your mind off of it. We're talking about, go to the store, go to a movie, just go do something enjoyable, take a drive to that waterfall or to that, thing. Just go do something. Get out of the house, get your mind off of it, etc. Certainly, for both men and women, sexual relations, whether it's individual or with somebody else, it can be a great source for stress relief. So don't, immediately, chalk that off. That can be a great way to reduce stress. Group number 4, is to get stuff done. I'm talking about getting stuff done that you need to get done. Get your chores done. Go, mow the lawn. Do something for someone else. One of my videos talks about going to a meeting and getting up there and telling people about your experience so that you could potentially help somebody who is also there at the meeting. Or if you have a relative or a friend or whatever who needs to be just treated well and have somebody to talk to, or to go volunteer with a group, or do something positive for yourself. Maybe work on your resume, or put out some job applications, or work on your next level of advancement for your training, or whatever it is. Do something positive and take that negative energy, that anger and the frustration and whatever's going on, and just drive it right into something that at the end you can say, boy, I made progress today. And that positivity helps quiet that internal negative voice. The other thing that, of course, hopefully everybody's working on is talking your way out of it. And so one story that I like to tell is about me and my son. So my wife and I were out, and my son was home with the dog. And we called him up and we said, when you go to your friend's house, make sure you put the dog outside. And so we got home, he was at his friend's house, and of course the dog was still inside. So, an hour later, whatever, he comes walking down the driveway, and I'm like, you didn't, I started yelling at him. And so, of course, a few minutes later, I was thinking to myself, okay, that was the wrong thing to do. Here's my son coming home. The first interaction he has with his father is his father's yelling at him. It just, and it doesn't really address the issue. Because after I thought about it for a while, it's like, I'm not really upset about the dog being left in the house, because nothing happened. Nothing was destroyed or whatever. It's a good dog. But the problem is that I was upset about, lack of responsibility, et cetera, et cetera. So I came back to my son a few minutes later, and I put my hand on his shoulder, and I said, I'm sorry about yelling at you, but next time we call you, why don't you write yourself a note and put it on the front door? And then I reached down, I grabbed his shoe, and I hung it on the doorknob. And I said, or you can just leave yourself like a little visual clue that you got to do something, kind of like tying a string around your finger. And so in the end, after thinking about it and working it out upstairs, I was able to readdress the issue in a way that wasn't angry, that actually addressed what I was actually upset about, not so much about the dog, but about the responsibility thing, and hopefully preventing this conflict in the future. And that's what I'm talking about as far as working it out. And it doesn't have to be necessarily working out with somebody else, but working out internally. What am I upset about and why? And so one of my patients the other day was telling me that she's trying to get custody back of her daughter, and she was told that her ex-husband, the father of the daughter, is using meth, although he has custody. And this is driving her to crave. And, so one of the things we talked about is, why are you upset? And it's not so much that he's using the meth or whatever he's using. It's because it turns around that she feels guilty, that she has developed chemical dependency. Her daughter's in a house with somebody who is using, and that she has contributed to this thing. And so I said, well, you're making progress, you're staying sober, you're going to meetings, et cetera, et cetera. And so turning around and being and saying, okay, this is what I'm actually upset about, and this is how I'm going to address the problem. Now, obviously, she can't fix the problem today, but she can work towards a solution in the future. And by kind of working it out in your mind and figuring out what you're actually upset about, and making positive changes to deal with that so that you don't deal with that in the future, can be a really effective strategy. So you're going to use the skills that you learned in counseling. You're going to count to 10, and you're going to kind of work it out. You're going to figure out what you actually are upset about, and make progress.